Hello, good afternoon, everyone. Thank you very much for joining us. I'd like to begin by introducing myself. My name is Allison Williams, and I'll be your host for the next hour. Joining us today is our guest speakers, Jan Chappell and Jean Bank. Both will be joining us a little bit later. And the purpose of our webinar today is to discuss why occupational health and safety professionals should be aware of a rapidly growing workforce demographic known as carer employees or carer workers or employed carers, and how we can best support and accommodate these employees in order to reduce the risks of injury, as well as protect the psychological health and safety of these employees and improve the operational success of a business or an employment workplace. So while this webinar is virtual, McMaster University recognizes and acknowledges that it is located on the traditional territories of the Mississauga and Haudenosaunee nations within the lands protected by the Dish with One Spoon Wampum Agreement. And we wanted to also recognize our funders. We're grateful for the support received from the Social Science and Humanities Research Council of Canada as part of a connection grant called Disseminating Tools for the Creation of Care-Friendly Workplaces in Canada. So just a little bit about me. I'm a professor in the School of Earth, Environment, and Society. I'm trained as a health geographer and interested in looking at the intersection specifically between the unpaid care environment and the employment environment. I've recently received a Tier 1 Canadian Research Chair in the Care Economy, Aging and Policy, and have just completed a 7-year National Research Partnership Grant focused on creating healthier, more care-inclusive workplaces across Canada and globally. Over my career, I've worked closely with not only researchers, but also various partners in businesses, in caregiver organizations, and in governmental and non-governmental organizations to help shape workplace policies that better support carer employees. I'm excited to be here today and facilitate and host this very important discussion. Joining us today is one of our guest speakers, Jan Chappell, who is a senior technical specialist with the Canadian Centre for Occupational Health and Safety, where she provides expertise in mental health, workplace safety, occupational hygiene, and education to CCOHS's team of specialists. Jan is the project lead for the Centre's online fact sheets and publications. She works on a variety of projects, including e-courses and creating web tools and mobile apps for organizations such as WorkSafe New Brunswick, Workplace Newfoundland, PEI, and WorkSafe Saskatchewan, and authoring e-learning courses. She's an active member of several Canadian Standards Association technical committees, including occupational health and safety training, incident investigation, management of impairment in the workplace. So welcome, Jan. Great to have you. We also have Jean Bank joining us today. Jean has over 2 decades of experience with management of standards and health and safety within the Canadian Standards Association. She's an accomplished project and program manager with over 25 years of experience specializing in health, safety, consumer policy, and aging-related issues. She has a long-standing record of leadership and service at the local, national, and international levels, particularly in healthcare and consumer advocacy. As a seasoned standards professional, Jean is actively engaged in several high-profile international committees, including the International Standards Organization Technical Committee 314 on Aging Societies, as well as 292 on Security and Resilience, as well as the ISO Consumer Policy Committee. Her extensive background in policy development and standards writing has positioned her as a key contributor in shaping frameworks that promote safety, resilience, and consumer well-being. So similarly, wonderful to have you here today, Jean. Thank you very much for joining us. So in today's webinar, we'll be covering a variety of topics beginning with first identifying what caregiver employees or carer employees, as they're sometimes called, what the demographic patterns look like specific to their current existence across the Canadian landscape, as well as looking at why this is an issue of concern given our growing aging population. We'll also then move to look at concerns specific to occupational health and safety in order to have our audience recognize the importance of this growing workforce demographic. Jan Chappell and Jean Bank will take some time during the webinar to share their expertise and experiences with connecting the dots between the balancing act of work and care within the framework of health and safety. We'll then explore a number of different tools and resources that are available, primarily through the partnership grant that I spoke to earlier. And these tools and resources are designed to help organizations and managers specifically build and sustain care inclusive practices with the objective of making an organization, their organization, a safer workplace for care employees. These include an online complementary standard and handbook, as well as additional tools available on our website and an online course made available through McMaster Continuing Education. I wanted to specify that care inclusive practices are very much within the framework of EDI or DEI, equity, diversity, and inclusion, sometimes known as employee engagement. As we know that, again, culture change and the invisibility of care employees often is barriers to recognizing this very important demographic. So including care employees within EDI or DEI policy is a really great move in order to ensure that they do feel included and can, in fact, self-identify at work and consequently not only be recognized, but also be best accommodated. So to better understand how important it is to recognize this particular demographic, we're going to look at a few statistics from the 2018 Statistics Canada General Social Survey, which showed that 1 in 4 Canadians are balancing work with unpaid care. And this equates to over 5.2 million Canadians, with this number expected to increase drastically over the coming years. And that's primarily due to population trends predicting that by 2030, older adults age 65 and over could make up almost a quarter of Canada's population. As the number of older adults in Canada increases, the number of caregivers is also expected to increase. And I should mention that when we talk about care employees, we're really focusing on those individuals who are caring for adult dependents, whether that be adult children or spouses, family members, in-laws, parents, siblings, et cetera, et cetera. We've even recognized the importance of caring for friends and neighbors with respect to folks who may, for example, not have biological supports or biological dependents, which we know include to LGBTQ folks within Canadian society. So with that in mind, the majority of unpaid carers are also working, and we know this number is approximately 70%. So again, there's close to 70% of unpaid carers who are simultaneously balancing unpaid care with paid employment. And this represents roughly 35% of our workforce, making this a highly relevant demographic of concern for organizations. And again, as I mentioned earlier, they're often hidden, they're often invisible. So managers, supervisors, leaders, anyone who is, again, in a leadership position within the workforce often doesn't know that they are care employees because they are invisible. Many care employees don't self-identify. They feel that their unpaid care role is a private matter and consequently don't bring that to the workplace. And so it's really our job to ensure that they are recognized and included to ensure positive employee work experience and efficient organizational operations. We also know that they represent the most experienced and skilled workforce, given that the majority of carer employees are between the ages of 40 and 59. So they're not only the most trained, but they're most experienced. So clearly, they're not a workforce that we want to lose, particularly given the challenges related to productivity in Canada and elsewhere. So now we're going to connect some of the dots with respect to the issue of occupational health and safety. And this illustration walks us through the negative possible outcomes associated with, again, juggling unpaid care with paid employment when there's no active workplace supports or accommodations to support better work-life balance. When an employee is overloaded with unpaid care duties outside of the workplace, which according to the Canadian Centre for Caregiving Excellence National Caregiver Survey, averages approximately 5 hours of active caregiving per day, their levels of stress and fatigue can go up in combination, again, with managing full or part-time employment. We know that the majority of care employees are employed full-time. So they are full-time employees for the most part. And when, again, they work an average of 5 unpaid caregiving days per day, totaling 25 per week, on top of full-time employment hours, they, again, experience the stress and fatigue and unfortunately risk injury. And as is noted in this illustration, when an employee is tired and stressed, again, they may present a higher likelihood of physical injury. For jobs based in sectors like construction, primary resource extraction, transportation, manufacturing, again, any physical occupation. We also know that there is this risk of psychological harm. So those working in office-based or knowledge-based environments can be more susceptible to short or long-term leave for mental health reasons. And we know from the literature that generally what happens with stress and fatigue with care employees is that self-care usually gets thrown out the window. And unfortunately, there is this psychological harm that starts to creep in. And it often shows up as depression and anxiety. And that can unfortunately spiral down further to a number of negative physical health outcomes. But if an employee is supported through, for example, mental health supports or a short or long-term leave, for example, they may be better able to manage and cope. And issues like presenteeism, for example, where the employee is physically present at work but distracted or exhausted and not necessarily performing at their best, we really need to recognize again how we can best ensure that they are able to participate more fully and productively in their paid employment. So what exactly is psychological health and safety? Well, according to the Public Health Agency of Canada, psychological health refers to the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and deal with the challenges that we face. It's a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. So that's clearly a mouthful, but it is a very all-encompassing, holistic definition that is very inclusive-oriented and, again, represents health very broadly. And certainly within the context of the workplace, and according to the Canadian Standards Association Psychological Health and Safe Workplace standard, we recognize that a workplace that promotes employee psychological well-being and actively works to prevent harm to worker psychological health, including negligent, reckless, or intentional ways, is a workplace that, again, is supporting care employees. And we can see through this this particular illustration that each week's 500,000 Canadians miss work due to psychological health issues. 1 in 5 Canadians experience psychological health issues yearly. They are the #1 cause of disability in Canada and can cost Canada approximately $51 billion per year. And they also affect mid-career employees the most, which again, these mid-career employees, coming back to that demographic of, again, the 40 to 69 age group. And so clearly, we would need to be cognizant of, again, the invisibility of this group, recognizing that only 23% of Canadians would feel comfortable talking to their employer about these issues. And certainly in the last decade, we've really been trying to challenge the stigma associated with psychological health. And psychological health and safety, again, is often what first shows up in the case of carer employees. So moving on to the business case, and this is certainly where we have a lot of traction with respect to the growing evidence around the reasons why organizations can benefit from supporting carer employees and building carer-friendly workplace policies. The benefits not only include cost savings, but increased productivity as well as loyalty and worker engagement. Because we know that carer employees that are supported and provided accommodation at the workplace are reportedly more productive, more present in completing their work duties, more satisfied with their job, and they experience better overall well-being. And certainly from an organizational perspective, this translates into less turnover, less absenteeism, a reduction in leaves. And we know from American data that was produced by the American Association of Retired Persons, otherwise known as ARP, that for every dollar spent on flex times, companies can expect a return on investment ranging from $1.70 to $4.34, while investments in telecommuting yield returns between $2.46 and $4.45. Also, a survey by Bloom found a direct link between caregiving policies at work and increased productivity among employees. So there's certainly clear benefits to supporting and accommodating care employees within your organization, especially with the focus on employee satisfaction and productivity. We also know that many of the most awarded employers who are providing gold standard supports for care employees confirm these data specific to, again, the business case. So I'm going to stop lecturing now, and I will pass the torch to our first guest speaker, Jan Chappell from the Canadian Centre for Occupational Health and Safety. Thank you very much, Jan.
Thank you, Allison. I'll just ask for a little forgiveness if my allergies are very bad today. So anyone else who's suffering from all this prolonged cool spring, trees can't get all their leaves out in one week. My empathy is with you, and I'm with you on that one. So let's just move right in. I want to make sure we have time for everyone to have their presentations. So when we look at program development, a lot of times it's done in silos, it's done piece by piece. And this isn't really ideal because what we want to look at is the complete picture. So we tend to call it a comprehensive workplace health program. And in that large sphere, we're looking at how do you protect people with their physical environment. So traditional ways of health and safety, reducing injuries, preventing accidents, that kind of stuff. But we're also now looking at, as Allison is talking, the psychosocial environment at work. So what's the culture like? How do these elements fit together? Where's the balance, civility, respect, growth and development, those areas? And other areas that we often don't see addressed, but when you look at this, as Allison just mentioned, the big fortune companies who can have a bigger approach, there's often elements of workplace health promotion. So helping people access resources that will help their personal health. It might be healthy eating or fitness opportunities, smoking cessation programs, things like that. And another really important element that most places don't consider is having a way to be involved in the community. It might be through volunteering or supporting people when they're volunteering, You might get a day that you can use as leave to go volunteer, something like that. Or the company does something as a group. It could be something even simpler, like allowing family to attend employer-sponsored vaccination clinics, so they don't have to make appointments with their doctor and everyone can get their vaccination at the same time. So sort of that corporate social responsibility elements. And we don't think of these as separate or distinct. We think of them as overlapping, kind of like we have here petals on a flower. And these all lead into a leadership engagement and worker involvement. And when you get that good synergy going, that's where you'll start to see the good returns on your psychological health and safety programs. So I didn't want to talk about the standards per se, because I know Jean's going to speak to them in a little more detail. But I did want to do a shout out to the CSA. There's Ed 1003 standard. It's their psychological health and safety standard in the workplace. It actually came out in 2008. And it was groundbreaking at the time. I know Jean's going to speak to it more. And they used 13 factors that they decided were the key elements in providing a psychological healthy and safe workplace. But what does that mean in a workplace? And it means you need to look at that bigger picture. So you're looking beyond health and safety, beyond injury prevention. And if you're in HR, it would be beyond recruitment and payroll and policy information. You're looking at how work is organized. And that might be roles and expectations. It could be job control or autonomy. It could be your workload, your pace of work, your scheduling, your working hours. Or it could be social factors, the relationships at work, how leadership works, how your culture is. Are you recognized for the work you do? And do you feel that you're rewarded sufficiently? Do you get the support that you need? Is everyone civil to each other at work? All these things matter. And when we start talking about the carer role, you'll see how all these elements combine together. And of course, your work environment, you need to have safe and appropriate equipment, your lighting, your ergonomics, your temperature, all that stuff. All those health and safety basics are still very important because you need to go home at the end of the day and be safe because you have this other role that you're doing when you're outside of the office. So let's look at the care employees and see how we can help them. Some of the research that Allison has made public over the years, you're seeing that a person in a carer role is missing days of work. Some take early retirement, some have to leave their job because they just can't fulfill all these roles at the same time. Very recently, my friend fell at home while she was at her home and broke her ankle. And so on the day of her surgery, that went well. She got her surgery and they sent her home. Well, she's unstable on her feet, which is why she fell in the first place. But she had a helper come in and then the helper had to leave and she still wasn't comfortable being on her own yet. So she called me up at about 7 o'clock at night and said, "Can you come over?" I said, "Sure." And it was fine to be there till midnight or whatever, because it was a Friday night. It didn't impact my day after. But it made me really empathize with people who do this every day for the people they care for. Because all of a sudden you're putting in 4 or 5 hours into a different role while you're helping people. And I think it's a very common event for carers. And I think also like caregiving is unpredictable. You don't know when it's going to happen. And you need to have these sort of mechanisms in place for the workforce to be prepared and help people the best. So the next slide, it's on the page, but we're going to pop it up as a quiz so you can answer what you think the answer is. So if you have been awake for 21 hours, this means you got about 3 hours of sleep, 4 hours of sleep. Is there a comparison to blood alcohol content? So like fatigue is a risk that's commonly cited in care research. And just wanted to highlight that fatigue isn't just physical. It's not just feeling tired. It can be psychological as well. So you can make errors in judgment. You can make mistakes when you're processing information, and those can have a huge impact in workplaces as well. So being awake for 21 hours is the same as the legal limit for driving in Canada at 0.8. So it's just one way to look at the impact of fatigue, because you always make the baby was up tonight, or I didn't get to sleep, or I didn't sleep well, because that's another thing that happens as we age. So it's good to think about that there's consequences to just something that we take for granted about, sleeping and not sleeping. So when you think about fatigue, all of these skills we're about to list are actually reduced. So it's your ability to make decisions, your ability to do complex planning, your communication skills, your productivity, performance, attention and vigilance, ability to handle stress, reaction time. The other ones are loss of memory or ability to recall details. You don't respond to changes in your environment as quickly as you would. So if you were a workplace, if you could develop a policy that would address all of these issues, it makes sense to me that you would. And helping workers balance their work and their career responsibilities will definitely help fill that gap. So when we were writing the standard, we were talking about how to make it understandable, how to make the mechanism part understandable to people who are familiar with management systems and stuff like that. So in health and safety, we use the term safety management systems, and that's basically a big word for a collection of processes, practices, procedures, policies developed in an organized way to manage what you're focusing on. So we use that framework, and the simplest framework that most people know was the Plan, Do, Check, Act. We used those requirements in that cyclic way to look at including care responsibilities as well. So you'll have under plan is when you do sort of your thinking about it. What are the legal requirements? What are your hazards? What are the hazards of someone coming in when they haven't had enough sleep? What are the hazards of them coming in an hour late because they had to deal with something at home before they could get to work? So you can think about those things and just sort of put that lens of being a carer on top of your policies and see where the gaps are. So you might want to review your policies to make sure you're dealing with stress management, that you're including that complex link between home and work. What types of leaves do you have, and under what circumstances do you let people do that? And maybe you can expand the scope of those a little bit to include a broader range of things. Excuse me. I know, for example, in our policies, if you have to say a person passes away, they wrote it in as people also living in the same residence. And that way you're covering alternative living arrangements, people that you care for, they're in your home kind of thing. They don't have to be a direct relative for you to get access to that leave, which is it opens the door a little bit and gives you that opportunity. So just take a look at things like personal emergency leave, family responsibilities, medical leave, and is there a way that you can broaden the scope so that carers can have a little bit more flex time or whatever they need to fulfill both of their roles, and you still get to have that valuable employee at your workplace. Just remember that everyone plays a role, so employers generally have the duty to identify and address any hazards. So if they're seeing fatigue as an issue, then that is something they have to address. They have to address the hazards that are present in the workplace and then communicate how they're going to manage those issues. So you might want to consider during team meetings or one-on-one chats, how's your week going? Is there any information you need? Is there anything you need to tell me? And the more you have those types of conversations, the better feedback you'll get from people. And you'll identify areas that are doing well, and you might identify areas that need more improvement. And then you can have that conversation with people to figure out what the priorities are and what the employer should be addressing. And as for workers, we need to provide that feedback. We need to be not afraid to speak up a little bit and say, hey, my plate's pretty full at home, or I have these roles that I fulfill. And, if every other week I could come in at a flex hour, I start at 9 instead of 8, so I can do the school drop off or something like that. Whatever it is, right now, my parent is going through a bunch of medical testing, so I need a little cluster of time off to help facilitate these medical appointments. These are the give and take back and forth, but I can make that up at another point or whatever your arrangement is. And I did want to do a little shout out to health and safety committees, just because in health and safety, they're the groups that are used to talking and bridging that gap. So don't forget to use them in your product, your program development. And always be inclusive. Involve the people who are living this life, right? Make sure that you have those conversations, but also talk to their coworkers and supervisors and see how you can make that balance in the workplace and between the groups, and make sure that everything feels comfortable and fair for everyone. So you might think that maybe working part-time is best, but maybe they want a little bit of flex time or bankable time. Because like I said earlier, caregiving is fluid and it changes over time for better or worse. So we just need to be mindful that you don't want to put up artificial barriers that don't need to be there. Like I say, it is a personal issue for each person. Each situation is different. And you want to try and make sure you're finding ways to have people speak up so your policies can match what their needs are. That's basically my quick little summary. Thank you.
Thank you very much, Jan. That was fabulous. And I'm sorry you're not feeling well due to your allergies, but
Yeah,
you pushed through. Good
I
job.
made it
Thank
through.
you.
I just made it through. Thank you.
Wonderful. So Jan's done a fabulous job of setting up the importance of attending to accommodation for care employees, given the occupational health and safety risks involved. Now we'll hear from Jean Bank, who again is our expert in standards development, who will talk about how standards can actually facilitate and play a role as a tool to ensure that we are supporting care employees. Thank you, Jan. Thank you, Jean.
Oh, thank you very much, Allison. I'm very pleased to participate in this webinar with Allison and Jan. I'm going to be providing a little bit more detailed information about the evolving role of occupational health and standards for worker health, safety, and well-being. Thank you. I think probably most of you are quite familiar with CSA standards and certified products for occupational health and safety. Our very first standard started in 1948, and that was for hard hats. And then over the years, that portfolio increased to include a number of standards for personal protective equipment, as well as standards for equipment, workplace practices. In the 1980s and 1990s, we got into things like ergonomics and other safety practices within the workplace. A large percentage of CSA's occupational health and safety standards are referenced in regulations or legislation, depending on the particular jurisdiction. It's hard to figure out exactly how many are referenced, but probably about 40 to 50% of those standards are referenced in whole or in part in regulations. And so one of the things that CSA did with the regulators federally and provincially was to develop a platform so that people could view those standards as an opportunity without having to purchase them. So that was a major innovation in terms of access and availability of those standards. So as the portfolio progressed, we then started to move into areas that are both physical and psychological safety. Next slide. So just a little bit of background on sort of the suite of standards that falls into this category. As Jan mentioned, the landmark standard was the Z1003, Psychological Health and Safety in the Workplace, that was published in 2013. I was the program manager for occupational health and safety for that particular standard. And I can tell you that at the time, business leaders, regulators really thought that it was impossible, that it couldn't be done. But in fact, we had an amazing multi-stakeholder committee that was able to bring that material together and to create this landmark standard. This standard was available as a free download, which increased its uptake and its awareness within the workplace. So building on that standard, the Carer Inclusive one that we're talking about today was published originally in 2017, and it also had a handbook. And Allison will talk a little bit more about those tools and resources that have helped to build awareness and implementation of that standard. We then moved into areas that were more sort of sector specific in terms of the psychological health and safety. And so we did one with regard to paramedic services, because those would be workers that suffered a great deal of harm psychologically in terms of the work. We also have a standard, and Jan's involved in this one, on management of impairment in the workplace. I think just looking at the leadership that Canada has shown in this area, it's demonstrated by the fact that 2 of those standards that were developed in Canada were then taken on board internationally. So we recently published a standard for psychological health safety at work, 45003, with ISO, and ISO 25551, that is basically the Carer Inclusive standard that's built on the Canadian standard. And that international standard, Allison led that project. She was the convener, and I had the pleasure of being the secretary for the working group. Thank you. So just a little bit more detail from a standards perspective around B701. Jan's provided some very good aspects in terms of the issues that need to be considered. Again, this was a multi-stakeholder committee. It actually even included international experts in terms of flagging this as a workplace concern. And it was certainly groundbreaking in its own right as well. It's very much, as Jan has indicated, it's a program standard. It gives you a roadmap, a very clear process, and a rationale for developing a program like this. And just to reinforce the point that Jan made, it's the beauty of this standard is that it fits into a health and safety program or management system, and so that you can literally plug this standard into an OSH management system or an OSH management program that you have in place. That it's got a basic structure that allows you to easily implement it. And again, there was a handbook to help employers implement it, and it was available as it's still available as a free download through the support of the partnership agreement that Allison was able to broker. Next. So you can have the best standard in the world, but if it's not used, it'll sit on a shelf. I think that one of the things that's really important with this standard is that it does need to be tailored, and it's designed so it can be easily tailored into an organization, whether that's a small organization or a particular sector. But there are some common principles that go along with successfully implementing a standard like this. Certainly, you need leadership commitment. You need to be able to assign the responsibility, and that business unit could vary depending on the type of organization you have and the structure of your organization. So it might be HR, it might be OSH, it might be, as Allison indicated, diversity and equity and inclusion. You really need to think about the resources. Those could be within the organization, they could be within your benefits plan, they could be at the community level. And in the carer space, there's a lot of community resources that can be tapped into if you're going to implement a standard like this. As I mentioned before, it's important to tailor it for your particular workplace makeup and risk factors. I think the biggest lesson that I learned in terms of the psychological health and safety standard is it's a journey. And it's really important to be able to take a phased approach and figure out what the best steps would be in terms of the implementation. Find those champions, engage all workers, because the co-workers are going to be as important as the managers and supervisors if this program is going to work. And as Jan has talked about, important to address issues such as stigma. As Allison has said, a lot of caregivers don't even identify as caregivers. Look at gender issues, look at age, as Allison has pointed out, in terms of the position that those people are in their life course as to the responsibilities and the importance for balance within their working environment. Next. So what's been the impact of the standard? This is always the question that's a little hard to quantify. But I think we know from research that the standard has helped to frame this issue as a very valid workplace concern. And Allison has highlighted some of that research. I think the access and use of the standard has greatly increased through the free downloads and the tools that McMaster has developed, as well as other partners. I think the pandemic has really reshaped employees' expectations around work-life balance. And that's this standard and the tools that it provides really help with that particular trend. It's been embraced by caregiver organizations, policymakers, and researchers, and it is a key element of work that has been cited in the development of our national caregiver strategy in Canada. And as I mentioned before, it was used as the basis for the international standard. I've included this statistic here for 45% of the workplaces are now looking at developing programs. So I think that's the sort of the impact that we're starting to see across the board. This is becoming mainstream, and there's an opportunity to be proactive. Next slide. So in conclusion, I really, from my background as an occupational health and safety standards developer, I can see that care inclusive practices really can create more healthy and safe work practices. It addresses very specific risk factors, as Jan has pointed out, such as fatigue, stress, work-life balance. As Allison has identified, the aging population is going to be increasing rapidly, and there are going to be an increasing number of carer employees. So this becomes even more important as we think about our aging societies. As Allison has talked about the business case, we know that this standard can increase engagement and employee retention. And my final shout out is to those occupational health and safety practitioners that I had the pleasure of working with for many years, is that I think that OSH practitioners are really well positioned to lead and to champion this work. They know how to engage employees. They know how to do risk assessments. They know how to build a program. They know how to identify resources, and they know how to work with joint health and safety committees. So I really think that this is an area where OSH practitioners can really make a difference in the workplace environment within their organizations. Thank you very much.
Fabulous. Thank you so much, Jane. That gave us a really nice overview of the standards process and the importance of their location within occupational health and safety. And certainly really appreciate your expertise and guidance over the years and in building these standards. So now we're going to move to our final component of our webinar, which is really to overview some key tools that are available as complementary downloads, either through the Canadian Standards Association or through our McMaster University Gender Work and Health website. There's also some really excellent around, again, care employees. Jean spoke specifically around the Carer Inclusive and Accommodating Workplace Standard, as well as the implementation guide or handbook. These are available for free download. You can either download them individually or as a package, and the QR code is there and available. And as I referred to earlier, both of these documents are applicable to any sector of any size. And they really allow an individual employer or workplace to really determine how to best implement it. So certainly some organizations have formally adopted the standard as a whole. Others have just taken pieces of it and offered, for example, flex policies as an opportunity for accommodation to all employees within their workplace. So again, depending upon the sector and the size of your organization, you can pick and choose the available accommodations that are provided in both the standard and the handbook. The important issue around, doing an environmental scan, ensuring that you have a committee with carer employees on board to see the gaps, determine what needs to be put in place to address those gaps, implement the program, and ensure that you're evaluating for ongoing progress and quality control to ensure, again, you're meeting the needs of this particular population is a very critical structure that is embedded in both these documents. We also have used both the standard and the handbook to create an online course with McMaster Continuing Education. And it is available, again, free of charge. It's a complimentary course that was launched in April of 2024 on National Caregiver Day. And this basically takes students through a 10-hour course. It's focused specifically on OSH professionals as well as HR professionals, and really allows individuals who are engaged in the course to pace at their own speed, how to best create care-friendly workplaces. There's also an opportunity to obtain a micro-credential if the assessments are completed. And it also, again, provides an opportunity for professionals to use this micro-credential towards the development of their hours, their professional development hours. We have a quote from one user who finished the course who mentioned, I thought it was engaging and informative and extremely valuable and easily digestible for any organization seeking to improve the well-being of their employees and reducing the negative impact on their bottom line due to absenteeism, presenteeism, and overall reduced productivity. The resource sets any organization up for its best chance for a successful care-friendly program implementation. And the beauty of this particular course offered through McMaster Continuing Education is that it's very hands-on. It's extremely practical. And it uses case studies. There's lots of really excellent videos of care employees' needs and requirements, and really gives a fulsome understanding of how we need to ensure that the stigma is addressed specific to care employees being able to speak up and self-identify, requiring that really important culture change to ensure, again, the importance of including these folks in EDI initiatives and overall initiatives specific to workplace health and well-being. And finally, I wanted to mention that there's a wide range of tools available on the McMaster website, Gender, Work, and Health, which can be accessed again through this QR code. And it also, again, is complimentary. All of these tools are available for free download. A workplace checklist for assessing burnout, as well as various occupational health and safety posters for the Occupational Health and Safety Board. So again, a wide range of tools can be accessed. And the important piece here is to ensure that you click on the employer tile. And that allows you to, again, access the tools and resources available to both employers, HR professionals, and OSH professionals in order to, again, access these free tools. Unfortunately, we're out of time, so we're going to close the webinar at this point. Certainly, if you have any further questions, please don't hesitate to reach out. You're welcome to email me at awill@mcmaster.ca, or certainly reach out to any of us here on the panel if you have any further questions or concerns. Thank you so much for your attention to this issue, and I wish you the very best in building your carer-friendly workplace within, again, your organization. Thank you and have a great day.